Hello, sir.
Hello.
Sir, usually we see the hormonal imbalance problem in women.
Yes.
Because of that PCOS and PCOD, is the cases that's seen in the women. So, is there a similar kind of problem seen in the men also, sir?
Yeah, so at the end of the day, everyone will have a hormonal imbalance in any point of time. So it could be in young age, it could be in the old age. When you start with the young age, hormone imbalance we see it is called hypogonadism. So for the hypogonadism to see it in the youngsters, it is due to different kind of syndromes. So one of the major syndromes which we see is Down syndrome or Klinefelter syndrome. So in these cases, by birth, due to their any issues in the hypothalamus pituitary axis, so the hormone imbalance will be commonly seen. But when we see it in the old age, that is due to body aging, the hormone levels definitely start coming down once you cross 37 to 38 years of age. So testosterone is one of that hormone which reduces by age. So any person who crosses 38 to 40 years of age, so there is 1% drop of testosterone for every year. So once when you calculate for 50 years old, it means his natural testosterone is already reduced by 14% of 100%. So where this imbalance will be corrected easily. And for this, worldwide there is a strong treatment protocols. Once any person who crosses 40 years of age, they will be started on regular checkups and constant treatments. So this is a simple problem which will cause infertility and impotency. So any patients who are trying for the baby, they need to once check their hormones. So the hormones which mainly affect infertility are FSH, follicle stimulating hormone, testosterone. So there are three types of testosterone. So there is something called total testosterone, there is a free testosterone, and there bioavailable testosterone. This testosterone will determine whether you will be having a normal spermatogenesis or not.
Okay.
So if you want normal spermatogenesis, that means your semen analysis should be normal. For that, this hormone should be normal. So any abnormality in this hormone, if at all it is too low, it is called hypogonadism. It is too high, it is called hypergonadism. So hypogonadism can be corrected by injections. So we will improve their hormone levels so that your spermatogenesis will become normal. But when we see a case of hypergonadism, we need to see what was the cause for this significant rise of these hormones.
Okay.
So if there is any significant rise of this FSH hormone or testosterone hormone, that will definitely cause infertility. That is called testicular failure. So in these cases, we need to very closely monitor this kind of people, and we can definitely correct this and definitely improve their chances.
Okay.
So in this hormones causing impotency, that means major hormones which causes impotency are testosterone again, and there are some other hormones like estradiol, luteinizing hormone, and prolactin. These hormones will also regulate impotency. So once these hormones are normal, the chance of impotency will come down.
Okay. So irrespective of age, can this be seen in the men whose age is below 40?
Yes, definitely. But luckily, this impotency issues in youngsters are definitely not caused by hormones. So in this people, the first cause of impotency or erectile dysfunction, the major cause will be anxiety, the performance anxieties. So they are trying to get intimate with their partner, and this anxiety might be causing that issue. So one is anxiety, second is stress. So lots of people, lots of youngsters, lots of software couples, lots of powerful couples. The problem here will be there are lots of stress. They take lots of stress at the workspace, and this work stress, they'll get it to the bedroom. When they are on the bed, this stress will definitely cause erectile dysfunction. And third major reason again is diabetics. In young age, the people who are having diabetic, so this is one of kind of metabolic disorder. So diabetes or dyslipidemia, that means high lipids, or that in simple language we say high cholesterol. This high cholesterol will obstruct the flow into your penis, so causing erectile dysfunction. So in young people, the very less chance of hormonal problems. the more problems will be their lifestyle problems or metabolic disorders or any injuries. So many people get injured while playing cricket in men, mostly when we see. So here also there is any injury to the nerve due to the ball, or they fell down, or any kind of accidents. So in that case also we see commonly erectile dysfunction.
Okay, usually in women, this hormonal imbalance causes PCOS and
Yes,
PCOD.
yes.
Is there any similar kind of effect that hormonal imbalance cause in men?
One thing again, during the birth, so testis grows inside the abdomen. So testis develops inside the abdomen. Once the baby is out of the womb of mother, this testis will come down and fix in the scrotum. When this testis is not fixed in the scrotum, that will cause severe abnormalities in the hormones. So that is one of the major reasons. That is called cryptorchidism. It could be two testes might not have descended down, or one testis might have not come down. So this will cause hormonal abnormalities, and this will lead to different issues like infertility or impotency. Or this will cause hypogonadism in youngsters due to non-development of the proper testis, where we don't see any mousse development or the beard development or the hair on the chest or in the armpits. So these are one of the indicators where every parent should look when they think their child has hit the puberty. So all these kids, all these mothers should at least check their kids for the hair growth.
Okay.
At least fathers should look for the testis size. So very small size of testis is always an indication that is baby is not developing the testis properly, or the testosterone hormone is too low. In these patients, once the testosterone levels are tested, if it is too low, there's lifestyle modifications, and there might be a chance that we might give a low dose of testosterone.
Okay. Is there a similar kind of phase that we see in women, like menopause? Is there a similar kind of phase in men also?
Yeah. So again, this is a case of we see like menopause. The terminology for andropause have not yet been completely described by the World Health Organization. But there's so many papers in the recent past have told only one thing: men also, when they are aging, they'll definitely have a problems of testosterone. So men age around 40, once men cross 40 years of age, so the testosterone levels will be falling drastically. So this testosterone had to be replaced. In Western countries, there's a strict protocol for that. So generally, all the till date, all the major health checkups never had testosterone. But now they have understood the importance of testosterone, and recently this testosterone has been added to the regular checkups. In Western countries, it has been there since last 30 years.
Okay.
Where the testosterone will be tested regularly, and the replacements are started at the earliest possible age. So once they have completed their family, that means they don't want any kids anymore. That is when they start their testosterone replacement therapy. In young people, when there is a testosterone issues, we start something called HCG. We don't directly go for testosterone. This HCG is an anecdote for testosterone, where this also stimulates the gonads and will release more hormones.
Okay. Is the treatment similar for the people, young people and the men who are aged above 40, sir?
For treatment of
hormonal imbalance.
Yes, definitely. In young people, I told you as earlier, no testosterone will be given to young people at all, because that will make sperm count to go zero. So never testosterone to youngsters below 35 years of age under any circumstances. So whoever, in young kids also, when you give when you think baby is very small to his age, the testis is not growing, still no testosterone. So many people try this giving a low dose of testosterone, but this will definitely affect their age. The body starts growing more abnormally than their age.
Yeah.
So no direct testosterone replacements in young kids also. There is always HCG for this.
Okay.
So in old people, yes, you can directly go for testosterone replacement therapy, where we give one testosterone every 3 months, and we test testosterone levels for every 3 months to see whether this testosterone has come back to normal or still there is an issue.
Are there any symptoms for andropause facing?
Yeah, again, see, andropause, as we have discussed earlier, we see around 50 years of age, 40 to 50 years of age group, more after once they cross 50 years of age. So this andropause, again, the major issue here in andropause will be loss of libido. That means the urge to have sex will be completely reduced, and the desire will be lost, and the sexual thoughts might also be coming down. So they won't be sexually active, and they can't regularly do the works which they used to do in a very young age. Like around 40, they used to walk for 5 miles a week, and but when they've reached 50 years, 2 miles might be a very long distance for them.
Okay.
Most of the people think that is the reason, that is just because of the age, but the testosterone is the main problem here.
Okay.
Once we analyze the problem here, once we understand the problem, what is going wrong, so once we replace the testosterone, things will definitely get better for them.
Sir, is there any chance that lifestyle and the habits that cause this hormonal imbalance in young people?
Yeah, again, smoking at very young age.
Okay.
So around we see so many school kids these days smoking at around 13 to 15 years of age, and very commonly they smoke weed in mostly Western countries. They think it is quite okay, because as we know, there are very less side effects which we know of weed regularly. So most of the people think that no people has died till date with weed, and they think it's absolutely normal. But so many papers, so many research papers only says this: once they start using weed, the testosterone levels in the body will come down. So once it has reached to a point where we can't replace it, that will definitely cause impotency and complete infertility.
Okay.
So whoever people are on this weed, please cut down that weed or completely stop it.
But it's in some parts of the countries, it is they had made it legal.
Yes,
you
yes,
said.
yes.
But
Yeah, see, basically the concept of becoming it legal started with treatment for glaucoma. So the glaucoma, for this glaucoma treatment, there is no actually treatment in medical side. So that is when the weed came into existence in Western countries. So once they started using weed, these glaucoma problems have come down drastically for them. So that is when the government of USA and FDA has approved usage of weed for this problem. But for recreational use, the only thing for recreational use is that gives you buzz, and they think it is absolutely okay for that. But definitely this will affect your hormones in your body. Chronic usage of this for at least 1 or 2 years will definitely and significantly reduce your testosterone levels.
okay.
So anyone who's on weed, whenever you're planning for pregnancy, in men or females, both, it affects you both way. In females, it will definitely reduce the quality of the egg.
Okay.
The egg which is released for every cycle, the quality is definitely hampered. And smoking also causes there are some chemicals in your in the smokes which causes to increase in the hepatic metabolism. This metabolism causes absorption of the hormones, sexual hormones more. That means the hormone which is required for day-to-day activity. So, but if the hormone is available for 3 hours, the people who smokes, for them it will be 1 hour. So this 2 hours is lost. And in these 3 hours, whatever metabolism which we required, like in these 3 hours, there will be normal spermatogenesis. But in these people, as the time lapse is reduced to 1 hour, so this will definitely affect their infertility and impotency.
Okay. Thank you, sir.
Yeah.
Yes, sir.